mynews.studio.
A heart transplant completed entirely by a robot. No hands inside the chest. Just steel, wires, and code. Could this change how we think about surgery forever?
Today is July 12th, 2025. What does it actually mean for a robot to perform a heart transplant, and how did we get here? Let's break down the details. The operation happened in the US using a fully robotic system. Think of the Da Vinci robot, but at a level where it's not assisting, it's doing the main event.
Right, and what's different this time is the role of the robot. Previously, robots would help with less complex tasks, suturing, maybe a bit of tissue manipulation. But here, the robot handled the entire heart transplant, guided by surgeons who controlled it with joysticks and pedals from behind a console. The system translated their movements into ultra-precise actions, removing human tremor.
So the robot's arms and instruments went in through small incisions, no breaking the sternum, no cracking open the chest. That's less trauma, less bleeding, and way faster recovery for the patient. How does that compare to traditional open-heart surgery?
Traditionally, a heart transplant involves a large incision splitting the sternum and a long recovery. With the robot, everything's done through tiny entry points using high-definition 3D cameras. The surgeon sees a magnified view and operates in real time, but the machine filters out shakes.
Wait, so even surgeons with steady hands can't match that level of precision?
Exactly. Even the steadiest hand can't eliminate every micro-movement. The robot translates the surgeon's intent into perfectly smooth actions, which is a huge advantage in such delicate procedures.
And because the robot is so precise, it opens up the possibility of performing these surgeries remotely. If you're a top surgeon in New York, could you operate on a patient in rural Montana without leaving your city?
That's the long-term vision. But for now, even having remote capability inside the hospital means more people can access these procedures, especially where there aren't enough highly specialized surgeons. This could save lives in underserved areas.
There's also a big impact on medical training. What's the path for surgeons now? Will they need to learn both traditional techniques and how to operate these robotic systems?
Absolutely. Training will change. You'll need to be skilled in classic cardiac surgery, but also fluent with simulation-based learning for robotics. There's a whole new layer: remote manipulation, troubleshooting, and managing complications unique to robotic procedures.
That brings up another question. If robots are taking on more responsibility, what safeguards are in place? How do we know it's safe?
There are several protocols. Surgeons never give up control. They're at the console for the entire operation. Preoperative planning is rigorous, and the robotic platforms have real-time monitoring to catch technical issues. If anything goes wrong, the system can alert the team instantly.
Does this change the ethical landscape? If a robot does most of the work, who's responsible if there's a mistake?
The responsibility still rests with the surgical team, but hospitals and manufacturers are developing clear guidelines. There's a debate now about how to balance innovation with safety and accountability.
And globally, the impact is massive. If these systems become widely available, could we see a world where heart transplants and other complex surgeries are as accessible as getting an MRI?
That's the hope. It could democratize access to life-saving procedures, especially in regions with few specialists. It also raises big questions about cost, equity, and how healthcare systems adapt to new technologies.
So we're looking at a new frontier in medicine. Robots delivering precision, surgeons guiding them, and the possibility of saving more lives, faster and safer.
From reducing trauma to expanding access, the world's first fully robotic heart transplant is more than a surgical milestone. It's a glimpse into the future of healthcare.
Thanks for joining us as we unpacked what might be the most important medical story of the year. Could your next surgery be done by a robot?
Thank you for listening. This episode was powered by the mynews.studio. Try now for free.